Welcome to the inaugural Inside Human Medicine podcast for 2024. I'm your host, Dr. Henry Ford, Dean and Chief Academic Officer at the University of Miami Miller School of Medicine. Today, I'm delighted to welcome to the studio the great Dr. Yiannis Chatzizisis, who happens to be an internationally renowned interventional cardiologist. He is the chief of the Division of Cardiovascular Medicine and also professor of medicine at the Miller School of Medicine in UHealth, our health system. Along with his many clinical and research accomplishments that address some of the most complex and challenging cardiovascular problems, Dr. Chatzizisis is an award-winning educator and a respected leader in computational simulations, virtual reality, and artificial intelligence, which will be the focus of our discussion today. But before we delve into these fascinating topics and innovations that you are known for, tell us a little bit about your journey. I guess growing up in northern Greece, a small town known as Thessaloniki, and to becoming the legendary interventional cardiologist that you are today.
Thank you for the invitation and the good words. And indeed, I grew up in northern Greece. Thessaloniki is my hometown. It's the second biggest city in Greece, like around 2 million population. In an environment which has been quite interesting culturally, located Greece at the corner of 3 continents, Asia, Europe, and Africa. The city itself, a cultural mixture between Middle East and European aspects, and in that environment, I grew up. I went to school. I did attend my medical school there, and I think I had a very interesting upgrowing there.
I understand that at some point during middle school, you fell in love with the concept of medicine and helping patients. Tell us about what triggered or ignited that interest or passion.
First of all, I was always, through my parents and through the whole environment culturally in Thessaloniki, I grew up in a very competitive academically environment. I got familiar very, very early in my school years with studying hard to expand my knowledge. I built a very strong, very robust background in mathematics, hardcore mathematics, combined with philosophy and literature study.
Renaissance.
Absolutely, it's the mother of philosophy is Greece. So, and this combination of mathematics and philosophy, I think, determined essentially the following steps in my life, including what we're doing today. And we can expand more on this later on. But in that context, I was, early in my middle school, late 80s, early 90s. And at that point, there was a growth of cardiac transplantation. Christian Barnard, the famous South African transplant surgeon, cardiac transplant surgeon, he did his first human-to-human cardiac transplantation late 60s. And then by the time of late 80s or 90s, this whole field of cardiac transplantation was flourishing and growing. And I remember him giving an interview, I saw him on the TV and talking very gloriously about, the perspective of saving lives with cardiac transplantation. And I got so much touched by this. And in that context of being very competitive as a personality, like studying, like mathematics, like philosophy, and now seeing, what opportunity you have by becoming a doctor to save lives, to give smile to human faces. At that point, I decided that, I have to become a doctor. I didn't decide about the specialty at that moment, but I felt this humanitarian aspect of being able to do something that can change the life of people, can help people live better and longer life. And then throughout the rest of the years, I was just building all my CV, if you want, all my mentality, all my soul and mind was around of becoming a doctor at some point.
truly fascinating that watching just one interview essentially was transformative. It changed your life and prompted you to follow your path into medicine. But why cardiology? I understand he was a cardiac surgeon.
Correct. That's true. Then I entered the medical school, and actually was among the top 10 in the ranks. Of those who succeeded to get to medical school in Greece, in Thessaloniki, and then throughout the medical school, the 6-year course, I started looking for the specialty that I would like to follow. I was in between cardiac surgery, cardiology, orthopedics. I went to some OR cases, orthopedic cases. I didn't feel like that much intrigued. I did see bypass surgeries. I didn't feel that so, but cardiology was essentially at that point very intriguing for me because it was a mixture of the sophistication of internal medicine with the hands-on of surgery. And at that point, cardiology was a subspecialty in which there was lots of drug research and device research. So all those three things, the research component, the hands-on of the surgery, plus the sophistication of internal medicine, made me believe that cardiology is going to be a very, very, very nice field for me. And I never regretted this.
Can you tell us any challenges that you had to overcome, some barriers you encountered, and how those help shape your decision and your approach to become the person you are?
I have to tell you that my family, actually I was the first doctor in our family. My family was very educated, but nobody had been a doctor until then. I only remember full support from my family. I cannot recollect any challenge. They were extremely supportive of my passion, because passion is what drives at the end of the day our future and our fate. And they were so supportive of my decision to become a doctor. And as long as I made this decision, they have been extremely supportive up until today.
Fantastic. So, I know since I was actively involved in the process, we're thrilled to welcome you to the Miller School and UHealth family over the past year, like 15 months or so. Tell us, why did you decide to make the move and come be part of this great place?
First of all, let me thank you publicly for bringing me here, and you have been a major component of this move for me here. And I believe that it was a very conscious decision of me and my family to come here, and for many reasons. As I told you, I believe that passion and excitement are the key words in whatever I do in my life. And I feel that this place, this city, this region, this area is full of passion and excitement. I love the idea of this diversity in population. I love the idea of this very broad healthcare system, very executive leadership model across the healthcare system and the medical school, talented staff and faculty around, institutes and centers, and of course the academic ecosystem of the University of Miami. So all those things made me believe that this is the right move for me. This is the moment for me to come here and then blend my passion and energy and perspective and know-how with the excitement and passion of this area.
And we're thrilled to have your leadership and innovative brilliance here. As I noted earlier, your leadership in the dynamic landscape of artificial intelligence, machine learning, extended reality, and other cutting-edge technologies has been quite impressive. When and how did you become involved in this particular subspecialty, so to speak?
Yeah, the digital, the computational technologies, the 21st computational technologies and digital health. That's a very, very interesting question. I believe it's all about two things: connecting the dots and timing. Mm-hmm. Those two factors, I think, play an important role in what we do in our lives in general. So connecting the dots, what happened is that after I finished my medical school, in my early years of my residency, I got involved with through a mentor with research in computational fluid dynamics. Mm-hmm. At that point, there was no AI, there was nothing of all this revolution that we encounter today. Then, when I came to Boston at the Brigham and Women's for my postdoctoral fellowship, I took this computational fluid dynamics experience and translated this to deep molecular vascular biology of atherosclerosis. So right now I have a component of vascular biology and at the same time computational fluid dynamics. Then I get my training in interventional cardiology. I become an interventional cardiologist, following my passion to have hands-on experience from surgery plus the sophistication of medicine. And then I realized through my profession, through my daily practice, that there's a gap in care. We see patients with stents to come back with heart attacks, need for another stent, or some of those die. And I felt that we need to do something about this. We need to do a better job in putting stents in patients' arteries. And I felt that we need to have better planning for our procedures. And I thought that what's best way, the most cost and time-effective way to plan those procedures. And then the computational component came to my mind at this point, because all this computational experience, all this computational simulation can be used to guide us for better planning of procedures. So you see now all this experience from computational fluid dynamics from the past comes into play to help us start putting algorithms and approaches to deliver better care and better stents for our patients. So that's essentially the connecting the dots part. And then the timing is very important, because we're lucky enough to live in an era of very strong computer power. AI now came into play. And then all this idea of using computational simulations to plan procedures through AI and computer power now can become more patient-specific and faster. And essentially, the AI helps us to implement all these computational simulations to, at the end of the day, help our patients to have better care for stents. So, connecting the dots, timing together, and here we are now.
Well, you clearly have done a great job integrating all of these great advances. In fact, you and your colleagues recently published a great paper in the journal, American Journal of Cardiology, right? It was titled Artificial Intelligence, Computational Simulations, and Extended Reality in Cardiovascular Interventions. So tell us a little bit about that framework. What is it that you were trying to convey in this particular paper about the integration of the specialties of these innovations?
Yeah, absolutely. So I put together a consortium of authors from all around the world, from Japan, Asia, Europe, to America. And what we did there is that we describe how, as you said, AI, computational simulations, and extended reality, those three pillars of what we call digital medicine nowadays, how they can help us transform patient care.
Cardiovascular.
Emphasis on cardiovascular. A little bit of intro here, if I may. The computational simulation is what? Essentially, you create a digital twin, a very faithful replica of the patient's heart, of the patient's coronary arteries, or whatever anatomy you study. And this becomes essentially the foundation to...
It's like an avatar.
Exactly. But it's a very faithful anatomically and physiologically replica. We call this digital twin. We take essentially the heart and the heart arteries from the body into the computer in a very faithful way. And this essentially becomes the foundation to run simulation, run infinite scenarios of anatomy, changing the plaque severity, the plaque configuration, the plaque materials, things that you cannot do in reality. So as long as you have a very faithful digital twin, this becomes the foundation to run infinite scenarios and create new knowledge, which you can at any point go back and test in reality.
Without getting too technical, how do you make a faithful digital twin of the heart?
And here now comes the AI, because the AI helps us make these digital twins, number one, faster, and then at the end of it, equally importantly, help us make them more patient-specific, patient-relevant. It's through the big data, essentially. By creating big data, you have AI to dig into this big data, and then you get the right configuration, the right recipe you want to make the simulations faster and make the simulations more patient-specific. And then when it comes to extended reality, which essentially is the umbrella that encompasses the virtual reality, yes.
So you have this digital twin. So give us an example of how this breakthrough can help influence an outcome.
I'll give you an example. We had the opportunity to do the first in the world all simulation guided left main PCI, left main intervention.
Left main artery.
Left main coronary artery.
Coronary artery, yes.
The left main coronary artery is the main stem of in the heart that supplies 2/3 of the heart with blood and food and oxygen. So very critical.
Is that the one that says can create widow?
Exactly. So it's a very critical anatomically part of the heart arteries, very vital part of the heart anatomy. And we had two female patients who happened to have significant blockage, disease in the left main. And what we did is we created this digital twin with imaging. We took their left main anatomy from their body into the computer in a very faithful way. The anatomy, the wall, the material properties of the plaque, the stenosis were very, very faithful. And then we entered this digital twin into our platform and allowed the simulation to run different scenarios of what would be the best therapy, the best stent position and stent size, diameter, length for each particular individual. So you see, it's very personalized, very individualized approach.
Precision medicine.
Exactly. And AI was essentially the toy here that helped the simulation platform to identify the best stenting technique and stenting approach for each individual. Then we took the patients back to the cath lab days later, and we delivered clinically the plan that was recommended, was planned by the simulation, by the digital approach, to the dot. The same balloons, the same inflation atmospheres, the same stent technique, everything was the same as predicted by the simulation.
So all the pre-procedural steps.
All the pre-procedural planning was executed clinically. Patients did very well. They're now like 2 years later. They have a fine life. They escaped the bypass surgery, which at the time could be like probably an option. And
before, what would have happened? Before this kind of careful planning and basically easy execution.
Without, but by failing to prepare, you're preparing to fail. As I said, through my practice, we have realized, and now it's a world epidemic, that stents tend to fail. Stents tend to fail up to sometimes 30%. 30% of the patients who get stents, especially in the critical left main, they come back with a new need for a new stent, with a heart attack, or some of them die. Why? We need to do a better job. And to do a better job, we need to plan. And to plan, the best way to plan is to use the digital technologies and use AI to accelerate this approach, make it more specific.
Fascinating application of the promises of incorporating AI, machine learning in our practice. This is great.
Planning.
That planning, and I think you have to be smart enough to understand how to integrate all those various technologies.
Correct.
And you've done it in a masterful way. And in fact, I want to segue to yet another important component, which is this concept of virtual clinical trial.
Yeah.
And again, using all the tools that you just talked about, right? So can you tell us about that?
The virtual clinical trials, the so-called in silico clinical trials. Mm-hmm. Again, this comes also from another fact. That's how it works. That's how life progresses. That's how medicine progresses. You observe something, and then you go back to the basic principles, mathematics, basic tools to find answers, biology, and then back to the clinical practice to apply the answers and change the field. So we realized that we live in a world of evidence-based medicine, which is based on performing randomized clinical trials to provide evidence and apply this evidence to patient care. But we noticed that these clinical trials, they have some limitations. even though they help a lot, they also have limitations. Number one limitation, they are very expensive.
Right.
Number two, they have difficulty to enroll patients. Number three, they're dramatically underrepresenting minorities, ethnicities, genders. And what we do is that we sometimes extrapolate knowledge from specific biased subgroups of patients to all ethnicities, different genders, and different minorities.
Exactly.
And that's not fair, and that's not correct. We have noticed also that about 30% of trials in medicine in general, not cardiology necessarily, they either don't come into fruition at all or they're delayed dramatically. And that's again because of the enrollment issue and because of the expenses. So we've noticed that clinical trials have these major limitations. And we feel that we need to come up with smarter ways to create clinical trials which are meaningful, cost and time effective. So what we propose here, and that's something that is an initiative right now at the NIH and FDA level, is to use the virtual clinical trial approach to facilitate clinical trials. So what is a virtual clinical trial? We don't take actual patients into the study, but we take patient anatomies when it comes to particularly to coronary artery disease.
More digital twins.
Exactly. And this way you can be more representative of more diverse, because it's easier to bring in like 500,000 or more than that anatomies from India, from Asia, from Europe, from Americas, including different ethnicities, different minorities, versus running an actual clinical trial. So in this more diverse patient anatomy population, we can run computational simulations and use AI to dig into this big data created by simulations. And we can extract meaningful signal about, when you compare two stents, for example, what is best. And then this knowledge can guide us towards a more specific, more targeted, actual clinical trial with actual patients and actual outcomes. But we expect from this clinical trial to have something more meaningful, because we have already the signal of the visual clinical trial. Plus, the power of the clinical trial will be way better than running a trial without the facilitation of the visual trial. And this way, as I said, we can have more meaningful results. We can eliminate the factor of delayed, very expensive clinical trials, and advanced knowledge. And that's something that is going to change the landscape, in my humble opinion, of how we practice medicine nowadays.
So it really enhances the predictive value.
Exactly.
And it can really allow you to fine-tune the sample size.
Exactly.
And everything. So that's fantastic. And I imagine that will help us accelerate approval of devices by the FDA.
Absolutely. Because, you run a clinical trial which is already guided by a visual clinical trial, and you have already got the signal from the visual trial to help you to run a more meaningful clinical trial.
Now, you're using all this great technology to advance cardiovascular care. Where do we balance all of these important considerations with the ethical considerations? Is there any issue there? Because on the surface, it would appear that using this digital twin concept should protect us from these ethical considerations. But I'd love to hear your thought about it.
That's a very good point. There's no holy grail, obviously. With digital twins and AI and simulations are tools in our armamentarium to help us do a better job. But we need to be able to use philosophy, to use wisdom, to use them for the good of the humanity. And here comes the limitations that these technologies have. Limitations related to finances, for example, they were very expensive, and this is an issue. Limitations related to technical issues, for example, they're not widely available. That's something that we need to work on. They're not real time, because, as I said, all these technologies should ideally be applied in real time at the point of care versus taking the patients off the table and and waiting for analysis to happen. And of course, there are ethical limitations, as you said, which is, if I can just phrase it in a very simple way, complication happens in a simulation-guided procedure. Whose fault is that? Simulations or doctors or both? And who is liable for this? So we need to do a better job to make these technologies real-time, more widely available, more affordable, and of course, identify the ethical, limitations and issues. But this limitation should not dissuade us from investing further, because this is the future, and we should not close our eyes to the future.
And that's a great segue into our last topic and the remaining few minutes. And you created the Center for Digital Cardiovascular Innovations. How does that fit in, and what do you hope to accomplish with that at the University of Miami?
Yeah, absolutely. We're very, very happy. We're very, very excited with this. And again, this is in line with all this passion and excitement mentality that we have. We live in a very, as I said, very fresh, very exciting society here in the ecosystem of the University of Miami. And I think that's the perfect suite here to establish this center. It's a very fresh initiative. Its mission is essentially to use 21st computational technologies to transform cardiovascular care, with emphasis on device research, development, and regulatory approval. And in that context, this center, now there are like around 15 researchers there, and the group is expanding. There's a group of engineers, experts in computer science, in AI, in visualization, biologists, MDs. It's a very versatile group of researchers, all aligned along the common goal to promote this mission of the center. And I believe this is a very unique opportunity. This center is a very, very unique venue for partnership, for synergy of philanthropy, device industry, regulatory bodies like FDA, and of course academia. So we're very, very excited. I think with hard work and systematic work, and we're ready for this, we will have great outcomes and great future out of this center.
So we can anticipate some fascinating cardiovascular devices that are going to transform our approach to cardiovascular care.
Yes, absolutely. We're partnering with industry and essentially regulatory bodies, industry, academia, together, the united forces to advance the field, run visual clinical trials, come up with faster, more meaningful, more time cost-effective knowledge, help industry to build devices which help our patients live longer and live better.
So, from the competitive young man growing up in northern Greece, in Thessaloniki, and loving math and philosophy, should have been Aristotle, but that notwithstanding, you hear a presentation by Dr. Christian Barnard, and that changes your life. And then now you wake up, you're a pioneer in the field of interventional cardiology, creating new devices and new approaches. How does that make you feel? How did you ever dream of something like that? And what's the message for other dreamers out there?
Yeah, I think that you put it very, very nicely, and it reflects the truth. I believe that all my life I was driven by a few principles. First of all, set very high goals, and that's my advice to our audience and to whoever is listening or seeing this today. So aim high, set high goals. Number two, never back down. I think that we should just keep going and fight against challenges, against difficulties. At the end, we will prevail. And of course, seek for new knowledge. Be open your horizons, and be open to learning, to new things. Don't restrict yourself. So don't back down. Work hard, aim high, and be open to new knowledge.
And predictions for the future?
The prediction for the future is that we will live in the fifth revolution of AI. Medicine will have an extremely high benefit from AI and all these digital technologies. The future is that we will have tools for better planning of our procedures, better decision making at the point of care, better education for our learners. With these tools, we can have them learn, as we say, greater, faster, better. These are 3 key words. And obviously, we can have these tools to help us accelerate our research, whether it's device or drug, and give to the humanity therapies and diagnostic tools and prevention approaches that will help them live, as I say, better life and longer life.
This is fantastic. And clearly, the Center for Digital Innovations in Cardiovascular Medicine that you've established has gone through a pivotal role in that process. And we are so fortunate to have you here.
Thank you.
Leading the charge in the division of cardiology. So thank you so very much for this fascinating discussion. And this has been our episode of Inside UMiami Medicine with the fabulous Yiannis Chatzizisis. And we look forward to more from him. And hopefully we can welcome you back and with the next after the next invention.
Absolutely. Thank you, Dean Ford. It was a marvelous discussion today, and I'm very humbled for being here today. Thank you so much.
Thank you very much.